Okay, it looks like it's 11 o'clock. We should get going. My name is Connie Johnson. I'm the fairly new now school support nurse liaison. I will be doing the meetings, I think, from now on, which I'm very excited about, and I'm so glad you could all join today. This is the same thing you guys have been doing for weeks and weeks. So we'll start out with the agenda with announcements, COVID data update, and then we have a guest speaker for the flu overview and reporting. We'll talk about resources and a question and answer. So as usual, please put any questions you have in the chat or unmute yourself. Everybody is muted for the meeting so far. So announcements, let's move on to the first one I wanted to talk about was the survey that we're going to be sending out soon. The objective is to gauge the value, time, frequency, and content of these weekly updates and identify goals for future planning. So please send us ideas, suggestions, topics, things you would like to see us do in these meetings for even into next fall. I do recognize that we only have maybe 2 or 3 more meetings before school's out for most of you. We'll continue to put out the agenda on our reminder emails for this meeting, so you can see what's coming up to happen, and hopefully COVID will stay controlled through the end of the school year, where we'll talk about that. So the COVID-19 data update. When I was looking at the CDC website, it's same as it has been, still low community level. We're 4% up increased in our test positivity, so we're up to 7.19% now. And so the CDC reporting of the other information was a little bit skewed, and we'll talk about that in the next slide. So I just have I pulled the 73.2% of ages 5+ are fully vaccinated. That would be the 2 doses, and then 48.1% of ages 12 and up are fully vaccinated with a first booster dose. So, and that's in Pima County. I thought that was interesting. If you want to go to the website, to the COVID CDC website, and check numbers in between our meetings, this is the way to do it. Okay, and so this is the same slide we've been using for a while, but as you can see over here, the case rate per 100,000 population is 0, which we know is not right. And that was as of this morning, what was listed for Pima County. So something's kind of screwy with the CDC reporting. But I put this in here just so you can see. And again, you have the tool to go in and look for it after this meeting to see what it would be to get updates. Our guest contributor today is Gretchen Peterson. She's our respiratory epidemiologist. I put her information here on the first slide, and we'll move on to her information. Gretchen?
Hi, Connie. Can you hear me okay?
I can, thank you.
Perfect. Yeah, thank you so much for having me. I'm excited to talk about flu. I know it's kind of an unusual year and kind of an unusual time, but we are seeing an uptick in flu these days. Just wanted to give a quick overview of kind of what it looks like. I'm sure a lot of schools are familiar with it, but just give you some helpful, useful information from our side of it. So real quick, the flu is a respiratory illness. It's not, it's different from kind of what the stomach flu people talk about. And it mainly affects the head, the nose, and the throat. And we see generally the nose, the throat, and the lungs. We see the highest rates. Generally this year it's been in 19 to, I believe, 29-year-olds, and then second highest rate is among 5 to 18-year-olds. So it is definitely affecting school children. And we usually see about 2 different types. There's A and there's B, and there can be different subtypes of those. So this year we're seeing a lot of type A, and this spreads by droplets. So like a lot of the COVID precautions we take of masking and the ways we try to prevent that spread, it's kind of the same way. So we see most of the activity or flu is normally happens between December and February, which is why they'll start rolling out in late August or September for you to get your flu shot. But it can continue as late as May. And that is kind of what we're seeing this year. We saw a spike in April of reporting. So it is not something that is done by any means in February. It can continue into the summer occasionally. And because of that, we do recommend that if you got a flu shot early in the season, so maybe like September, October of 2021, I know that's when I got mine, you can get another one these days, April or May, and it's still a useful thing. You can kind of reboost that immunity. And just for awareness, the symptoms of flu, we're seeing fever, usually 100 degrees or higher degrees Fahrenheit, cough, sore throat, runny or stuffy nose, muscle or body aches or myalgia, headache, fatigue or tiredness, and sometimes it can present with vomiting or diarrhea. And there's just a quick visual for you of the difference between droplet and airborne transmission. And droplet is the one we want to focus on because that is how flu spreads. So cough, sneezes, saliva, mucus, things from your nose, which again is just emphasizes the importance of covering your cough, sneezing into your elbow, washing your hands a lot. And if you want to go to the next slide. All right. The main thing that we want to empower your teams with is how we can do reporting and mitigation. And I know it's not a new thing by any means, but just to give you some real clear-cut information around when you need to report. Reporting is only required for schools if at least 10% of a given classroom or a given entire student body is affected. But by no means should you feel like you can't reach out and say, hey, we're seeing high number of cases. We're kind of worried about this, or I don't know if it's 10% yet, but it's concerning. We definitely want to be a resource for you and empower you. Connie with the schools team, and I am also happy to help as well. We kind of collaborate on these things. So we just ask that you would, as you're able, take a continual look and just keep an eye on if you have any absences that are higher than normal, especially in particular classes, maybe a cluster of people. And if the parents that call in for their sick kids are reporting they're having colds or respiratory symptoms like the ones we went over before. In the event that there is possibly an outbreak of flu or influenza-like illness, so something that's presenting as flu, maybe it's not confirmed yet, we'll end up, we'll collaborate with you. We'll get on a call or an email and check out kind of the numbers there and make sure we know what's going on. And then eventually we will reach out and ask for a line list, which is just kind of an Excel document listing the students who are affected, the grade or classroom they're in, or if their staff, their symptoms and when they started, how to get in touch with parents if we ever should need to do that, and then whether they've been confirmed through a test or a doctor's visit, and whether they've had a flu shot. And that just gives us, along with the total number, kind of a denominator in that class or that group of people, whatever it is, that gives us just a really good snapshot. So we can kind of track and see if cases are going up there, if we need to offer any more support. And when you do have folks who are diagnosed with or seem to have flu, we want to make sure that you are able to have them stay out of school until they've been naturally fever-free for at least 24 hours. What that means is that they wouldn't have had something like an NSAID or an anti-inflammatory, a fever-reducing drug like acetaminophen. They would have, their their fever would have gone away without that and they would have been free of that for 24 hours. Or if they maybe never had a fever, at least make sure that they're symptom free before they come back, just to prevent further spread. And I know y'all have heard about this from us before, and I'm sure you're doing awesome with it. But just again, emphasizing the cleaning. That virus can live and droplets on surfaces for about 4 hours. So just making sure that there are general good daily or twice daily cleaning routines done with EPA approved cleaning agents. And we can get that information to you if you have questions about that as well. Having periodic hand washing times that are monitored, making sure that we just reduce spread in classrooms. And then masking can be a way to prevent the spread, as we saw with COVID. So that's always an option, it can be helpful. And if you should have a flu outbreak, kind of the steps we go through where we get this list from you. We'll also can provide you with a template for a letter you can send out to parents of any students in an affected classroom or school, just kind of notifying them, hey, we're seeing increased cases in this class. Here's how you can prevent transmission. And then here's what to do if your child gets the flu, how to contact the school. We're working with the health department, all of that. And last but not least, that letter will also emphasize the importance of getting the flu vaccine, like I talked about on the last slide. That's something we also are happy to be a resource for if your school really needs maybe to come and have us provide education or get you in touch with flu vaccines. And also pass along that information to parents of their primary care providers, a lot of pharmacies, as well as if you go to www.flu.gov, making sure they get their annual flu shot for their kid so that they're less likely to get the flu, or if they get the flu that season, it's less severe. And I believe that is about all I have for you. I'm happy to take questions if you have any. And as always, please feel free to reach out to me or the schools team. We're happy to be a resource for you.
I have a question.
Yeah.
Okay, so so the flu and COVID are very similar, right? I mean, I've always understood it to be COVID, a form of the flu, right? So should we be testing kids with COVID kits that we still have available from the health department if they present with symptoms? Because I still have a lot of COVID kits that we're not testing anymore. According to the health department, they don't really recommend us testing students because of the numbers they've dropped. So is that something that would detect on a COVID test, or is it just specifically COVID's COVID and flu's the flu and they're two different tests?
Yeah, a COVID test wouldn't generally show you a flu result, but if the child is having symptoms, anything is ill, we'd want to make sure that they do get tested for COVID as well as, yeah, and I'm going to refer to Anissa here because I know she's a great resource for that.
Thank you. Yes, I agree with Gretchen. So anytime you are suspecting those respiratory symptoms, you may want to just rule out COVID. So having that COVID test is helpful. The same with, I just wanted to make a quick note here. Our supervisor wanted us to mention this, that we are seeing an increase of suspect norovirus, which is what Gretchen had mentioned earlier, that sometimes we mix up influenza and we call norovirus stomach flu. But because kids' symptoms can be a little bit different than adults who have influenza or norovirus or COVID, they tend to have a different kind of set of symptoms sometimes. Ruling out COVID with that test, with any kind of symptomatic case where this isn't normal kind of behavior for the child, that it's not a dietary thing and they're having vomiting, yes, please please test for COVID because it could be influenza. We're seeing a strain of influenza that's causing these symptoms. And we're also seeing, of course, like I said, norovirus. So please go ahead and use those tests. That's what they're there for. And you can refer to the schools team to contact us if you have questions on that. So I just wanted to throw that in there. Thank you. And wonderful presentation, Gretchen. Thank you.
Thanks, Anissa.
I have another question. Thank you for that information. So are you guys noticing a lower amount of flu, being that most kids are, several kids are vaccinated for COVID? Does that bring down the flu numbers?
So we, since the COVID and the flu vaccines are different things, generally we don't, I think, attribute the COVID vaccine to giving immunity to the flu. I know that mitigation efforts in general, like hand washing or masking, can kind of keep anything like that from spreading. So that's, if they're lower numbers, that could be a possible reason for why that's happening. But I know the flu vaccine is generally what's going to keep you from getting the flu or getting sicker with the flu, and the COVID vaccine is more for COVID. Yeah. Okay.
All right. Thank you.
Hi, I just wanted to clear something up real quick. I'm just going to hop in here, Connie. Hi, everybody. So yeah, as Gretchen kind of mentioned, the flu virus and the COVID virus are two separate viruses. So any vaccine for COVID or vaccine for the flu is not going to protect from the other, although mitigation measures like hand washing and covering your mouth when coughing and sneezing, social distancing, wearing masks, those types of mitigation measures can be protective against both flu and COVID because they're spread in similar ways. So I just wanted to clear that up real quick. Also, we have COVID vaccines here at the Abrams building and flu vaccines. So if you have children that still need flu vaccines, even though it's not the normal season right now, we are still giving flu vaccines here at Abrams. So you're welcome to refer people here. The address real quick is just 3950 South Country Club Road. So just wanted to put that out there for you guys as a resource. And so that helps. Thank you guys.
I see some question. Go ahead.
Oh, I'm sorry. Kate, can they get the flu and the COVID vaccine at the same time?
Yes, they can.
Okay, thank you.
I see some questions in the chat about summer school, and I think that we can address that. If you have questions, send us an email. I don't know that that's been discussed very much yet. I haven't heard too much about it. Kat, do you have any information about that?
Sorry, I don't see a question in the chat about summer school.
It says, will we be expected to report, or is that still up in the air? I'm assuming it will still be reporting the same way, but the staff that they have available to do that may be different.
Yeah, if you're having outbreaks, we do recommend that you contact us and just let us know that there's an outbreak. But our reporting is likely going to be changing in the next couple weeks anyway. So we will let you know soon what that reporting will look like.
Thank you. And it sounds like there's another sanitary measure guideline coming out. Kat, is that what I've heard?
It may change. I'm not sure what that will be at the moment.
Okay. So that, thank you, Gretchen and Anissa, for speaking. It was really helpful to have both of you here. I appreciate that.
Connie, before they leave, this is Kathy Steinle. Can I hop
Sure.
in? I have a question that I
Sure.
probably get both of them. And Anissa, I apologize ahead of time. I know we had a discussion and that, yes, norovirus is listed on the communicable disease to be reported list, and the schools are cleared to have line lists and report that with demographic information to you all. Don't shoot me, but I'm looking and I don't think influenza or influenza-like illnesses are listed. And this has become more of an issue in some of our districts where legal, since we can't, without the sanitary measure, we're constrained from sharing the demographics like we have been up until the emergency measure expired. We can't communicate that, and we're under more, what's the word I want? Restrictions on what can and cannot be reported to the health department. Am I right in looking at this list saying that influenza-like illness is not listed? The only thing I'm seeing is death.
That is correct, Kathy. And that's something I brought up to our director. So previously, pre-COVID, we would get these line lists under surveillance kind of requests from our state health department. We know Maricopa County has like the CHIP program and they do their surveillance that way. Pima County always just had a good rapport with schools, but because of this, I guess, COVID reporting issue, that's changed a lot of other morbidities, and we are aware of that on this side. So we've made a request to the state. So if anything new does come down, of course, you'll be the first to know. And we do appreciate that relationship with all of you school nurses and health aides. And so yes, so that's currently the request. However, we still would like at least a heads up. We'd hate to hear something in the media that, you know, so-and-so school's having a major flu outbreak and we have no idea and we can't help you. So in the means that you're able to legally, of course, until anything changes, if we could still have that communication, so at least we have aggregate numbers.
I think we can give you
yeah.
numbers. We just can't give you specific names and like phone numbers and demographics. So
Right,
I don't
right.
think there would be any problem in saying we have seen an uptick and we currently at this school have X number of suspected cases and these are the symptoms.
Right, that'll have to just work for now until we can hear from the state otherwise on anything that may change in the future. But as of now, unfortunately, if we have another kind of H1N1 situation, that could all change again, right? So we know that. So yes, we do appreciate that, Kathy, and to all of you. And then Gretchen is our respiratory epidemiologist too, so please feel free to reach out to her as well. And you can call the same number, the same epidemiology number. So, and I believe that Connie had posted her information on there, and I'm always here as well. So we want to get back and start working with our schools again.
And probably the easiest thing is, I know in the past when we had suspected influenza issues, we used the influenza-like illness line list, and there's no reason why that couldn't be used without the students' identifiers to list the symptoms and the numbers.
Exactly. And still the mitigation efforts are the same as well, right? So because influenza is considered a lab reportable, my best guidance to you as well, in addition is to letting us know, is also encouraging parents to not only get their children vaccinated for flu, but also to take their child to be evaluated and have a rapid flu test done. So at least we can tie those close ends on our side for surveillance.
Okay, thank you, Anissa.
Thank you.
Any other questions? I see a couple of other things in the chat. We can answer those separately for you that wrote in. I don't know that those need to be general answers. So I wanted to talk about the resources that I put here. I added 2 to the usual resource page that we've been putting on weekly. The last sanitary measure update was on April 15th. I put that link to that one on here. And then at the bottom, I put our information for the school support team. We are monitoring that email regularly. We are monitoring any phone calls, any messages as soon as possible. So please feel free to reach out to us. And I really just wanted to add one last thing about, are there any more questions first? Okay, I also just wanted to say thank you to everybody that has been so kind and so full of information. I've been trying to get my feet on the ground in this role and work with Matt and the school support team. It's a lot, but we're going to make some big progress with things, and I really appreciate everyone helping out and being kind to me. Thank you. All right, if that's it, then I guess we'll end the meeting for today, and we'll see you next week. Thank you.
Thank you.
Thank you.